My name is Dave Hoylo, and hosting today in partnership with Kurt Sarnowski, senior consultant that runs a Social Security consulting and Medicare planning group. A quick background on Kurt is we've certainly professionally known each other a number of years, but have worked together on these seminars in a number of forums. Kurt is very well represented background-wise in Social Security. He's close to 40 years with Social Security on various roles of consulting and educating and management. So with that, I'll turn it over to Kurt, and we'll listen to his knowledge on these two important topics.
Thanks, Dave, and good afternoon, everyone. Hope you're all staying safe and healthy and enjoying this beautiful spring-like weather. Yeah, I'm Kurt Sarnowski. I worked for the Social Security Administration actually for 34 years, spent 20 years as the communications director in New England. Now I've been retired for 12 years, but I continue to work with Social Security, helping to educate people about the program. And as I go out and talk to people now, and even then when I was working at Social Security, I think the most frequently asked question had to be, when should I take my money? So most people's tops on their minds in terms of dealing with Social Security. So I want to spend a little bit of time talking about that to start. Understand this, under the rules of the program, you've got a lot of choices and you've got a lot of options as to when you can start to collect. And what I'll try and do in our time together this morning is help you fully understand what those choices and options are. In other words, I want to help you understand what you can do under the program in terms of collecting benefits. But in terms of deciding what you should do, I believe firmly that's entirely your choice, your decision. After all, you're the ones who worked and paid into the program. I can't tell you what you should do, but I also believe that if you don't know what you can do, you're in no position to decide what you should do. So let's make sure you have a full understanding what those choices and options are. So then once you know what you can do, you can make that informed decision about what you should do. And the place to start in all of this is by knowing what Social Security calls your full retirement age. Key concept under the program. Now, when Social Security started back in 1935, Congress set full retirement age as the month you turned age 65. It was age 65 for everyone without exception. And in fact, continued that way till 1983 when Congress changed the law, partially in recognition that life expectancy was increasing, and it increased this concept of Social Security full retirement age for anyone born 1938 or later. Now, this increase gradually been phasing in over time, at the point where for a big chunk of us baby boomers, and if it's happened to have been born between 1943 and 1954, our full retirement age was the month we turned age 66. But it's important to note this increase continues and tops out right now. Anyone born 1960 or later has a Social Security full retirement age as the month he or she turns age 67. Now understand this, collecting at your full retirement age month, that isn't your only choice. This isn't your only option. But make sure you know what your full retirement age month is, because you'll see as we go through the discussion this afternoon, a number of features of the program do flow from at least having reached your Social Security full retirement age. So make sure you know what yours is. But in terms of collecting benefits, you have to start at that full retirement age month. That means one thing and one thing only. It means you'll receive 100% of the amount your work and earnings entitled you to collect. That's what collecting at full retirement age means. You get 100% of your benefit. But among the options you have are to start collecting prior to reaching your full retirement age month, if that makes sense for you. And under the rules today, you can start to collect Social Security retirement benefits as early as the month you turn age 62, or at any point in between, by the way. But here's the thing, Social Security, as the name implies, is a social insurance program. And Congress has built certain social goals into it. And one is a hope that at the end of the day, based on average life expectancy, you'll end up with roughly the same amount of total lifetime Social Security benefits, regardless of when you start to collect. And so you ought to start collecting prior to hitting your full retirement age month. Well, then by starting sooner, in theory anyway, you'll now be collecting for a longer period of time. you'll find that your monthly payment amount gets reduced. For each month prior to your full retirement age you opt to collect, you'll see that that full retirement age benefit amount is reduced by roughly 0.5%. A 0.5% per month reduction, that translates into a roughly 6% per year reduction by starting early. But the important thing is you don't have to start collecting right on your birthday. You don't have to start collecting the first of the calendar year. You can opt to collect at whatever point you choose to, but understand that if you're opting to start prior to hitting your full retirement age month, you're going to see that full retirement age benefit reduced by roughly 0.5% for each month that you're going to be collecting. And oh yeah, it's a permanent reduction. Now, one of the many myths that are out there, too many folks mistakenly think, yeah, I know, I'll start early, I'll get less, but as soon as I hit my full retirement age, my benefit's going to go back up, right? No, it's a permanent reduction. Again, the idea being by starting sooner, well, then in theory, you'll be collecting for a longer period of time. So you're given less on an individual monthly basis. With the whole idea being, though, at the end of the day, based on average life expectancy, you'll end up with roughly the same amount of total lifetime benefits. Now, as I mentioned, you start at your full retirement age. That's when you get 100%. But among the options you have are to wait past your full retirement age before starting, if that makes sense for you. And with that social insurance idea in place, then, if you opt to wait a little bit and start later, well, then in theory anyway, you'll now be collecting for a shorter period of time. So by all rights, your monthly benefit ought to be increased if you wait. And it is. These are referred to as delayed retirement credits. And for each month now, past your full retirement age, that you opt not to collect, you'll see that full retirement age benefit now increased by 0.2%. Now, 0.2% per month increase, that translates into an 8% per year increase by waiting. But again, you don't have to not collect for a full year to get those delayed retirement credits. For each month past your full retirement age, you defer. That full retirement age benefit amount now permanently increased by 0.2%. Here's the key thing. Delayed retirement credits only accrue from your full retirement age month until the month you turn age 70. Now understand this, under the rules of the program, you never have to take your Social Security benefits. It's not like there's a required minimum distribution like there is with your IRA or 401k or 403b, but you opt to defer from your full retirement age month until you turn 70. You'll see your benefit increase by 0.2% for each month that you haven't collected. You opt to wait past age 70 before starting, and certainly it's your right to do so, but you'll see no additional increase over what you would have received at age 70 had you started then. Let me give you an example to illustrate what I'm talking about. We get somebody with a full retirement age of 67. And let's say at her full retirement age of 67, she'd get $1,000 a month. What are the options that are available to her? Well, we'll oversimplify the example. We won't factor in COLAs, but COLAs lift all boats equally. But she wants to start collecting right at the earliest point, right at age 62. She gets 70% of her full retirement age amount. So full retirement age amount, 1,000. She opts to start at 62. She gets $700 per month and continuing. Well, yeah, she's getting 30% less each month than she'd receive if she waited. But the trade-off, obviously, she receives that lower amount sooner, and in theory anyway, will now collect it for a longer period of time. Say she wants to wait, start at age 64. Well, benefit will be higher, or the reduction a little lower, meaning at age 64, she'd get $800 per month and continuing. At age 67, her full retirement age, that's when she gets $1,000 a month, 100% of the benefit she's entitled to. But say she wants to wait a little bit, start 1 year later at age 68. Well, that 1 year's worth of deferral means the payment is going to be 8% higher when she starts to collect it, meaning her benefit not $1,000 a month. No, it's $1,080 per month and continuing. and say she wants to wait all the way until age 70 before starting, well, now she'll see her full retirement age benefit increase by 8% for each one of those 3 years that she's waited. And it's simple interest, not compounded. But it means her payment at age 70 is 24% higher than her full retirement age amount, meaning at age 70, doesn't get $1,000 a month. No, she gets $1,240 per month and continuing. Let's say she wants to wait and start at age 72. Still going to be that same $1,240, right? Because there are no additional delayed retirement credits past age 70. Bottom line is, I always say, it's your choice, your decision. What are the things you ought to be thinking about? Well, you know as well as I do, your health for one, right? Longevity for a second factor. You need the money. You're going to keep working. All those factors come into play. But the whole idea always used to be that based on average life expectancy, it was all supposed to come out about even. But you know what? Life expectancy is increasing these days. Social Security numbers say 65-year-old man today, on average, going to live to age 84. 65-year-old woman, on average, going to live to age 86. But even more telling to me, Social Security numbers say of today's 65-year-olds, 1 in 3 now expected to live to age 90, 1 in 7 age 95. We baby boomers and those that come after us now need to recognize that retirement for us could be a period of 20, 25, or maybe even 30 or more years in length. And so my personal view tends to be, because for most of us boomers, if we have any pension at all, far more likely to be the defined contribution type, right? 401k, 403b, where we're walking out the door and that with a guaranteed stream of lifetime income, like you used to get with that traditional defined benefit pension. No, we're walking out the door with a pile of money. It seems likely to me that later in retirement, the pile of money will have diminished somewhat. Later in retirement, almost certainly healthcare costs are going to be higher. So you may have a greater need for a higher monthly income later in retirement than when you make that initial transition. And one way you can help meet that need is by delaying the start of your Social Security benefits. But again, as I said right up front, it's not for me to say. It's your choice, your decision. But I want you to be making an informed decision to fully understand your choices and options. And in its simplest form, you start sooner, you get a lower amount for the rest of your life. You wait longer before you start, you get a higher payment amount for the rest of your life. But to me, the important thing is, back in the day when Congress set the reduction rate and increase rate, based on average life expectancy at the time, it was all supposed to come out about even. But these days, because life expectancy is increasing, tend to think that maybe good things come to those who wait. But again, it's not for me to say, your choice, your decision. But as I said up front, I want you to be making an informed decision and make that right decision that's best for you, because there is no one single decision that's right for everybody. So we talked about the when you can collect. I want to spend a few minutes talking about spousal benefits, divorce spousal benefits, and survivor benefits. A lot of interest in these topics as well. So let's talk about spousal benefits. Now, for those of you who may have been paying attention in the Social Security world over the past 20 years or so, may have remembered that there were a number of esoteric Social Security claiming strategies that were out there that were all the rage. There were these claiming strategies that couples could utilize as a way to optimize or maximize their lifetime Social Security benefits. Strategies included file and suspend, claim some now, claim more later, or filing a restricted application. Again, all of these strategies are ways that couples could optimize or maximize their lifetime Social Security benefits. In fact, they were great deals. In fact, they were such great deals that Congress eliminated them back in the end of 2015 with passage of something called the Bipartisan Budget Bill of 2015. And so since the elimination of these claiming strategies, spousal benefit calculations have basically reverted to the fundamentals, the basic rules. And so let's help you understand the spousal benefit operation these days with the elimination of all of those esoteric claiming strategies. So these days you go to Social Security and you say, I want to collect Social Security spousal benefits. Under the rules these days, Social Security says, well, all well and good, but you have to take your own retirement benefit first. Under one of those old claiming strategies, claim some now, claim more later, If you had reached your full retirement age, you had the option of deferring collection of your own retirement benefit and taking just the spousal benefit. That's what's been eliminated. So at whatever point these days you go to Social Security, you have to take your own retirement benefit first. At that point, Social Security will investigate whether you might be eligible to collect some additional money as a spouse. And to do that, they're going to compare your full retirement age benefit amount with 50% of your spouse's full retirement age benefit amount. And if your own full retirement age benefit amount exceeds 50% of your spouse's full retirement age benefit amount, then there are no spousal benefits payable. You collect solely based on your own work record. But if your own full retirement age amount is less than 50% of your spouse's full retirement age amount, well, again, you collect your own and you'll now be due some additional money on top of your own benefit, bringing you up potentially to that 50% of your spouse's full retirement age amount. Now, the key thing is, in order for you to be able to receive this additional spousal portion, your spouse must be collecting his or her own retirement benefit. Unless your spouse is collecting his or her own benefit, you can only collect based on your own work record. Earliest age you can collect that spousal portion, no different than the retirement program. If you're at your full retirement age, that's when you get the full 50%. If you're younger than that, the payment's reduced. And third key point to remind you of is that this spousal benefit is based on 50% of the spouse's full retirement age amount, not necessarily 50% of what he or she might actually be collecting. Here's an example. Your benefit, $800 a month at full retirement age. Your spouse's benefit, $1,000 at full retirement age. You go to Social Security. Because your own benefit exceeds 50% of your spouse's full retirement age amount, you collect based solely on your work record, all right? Spousal benefits, 50% of your spouse's full retirement age amount or your own, one amount or the other, whichever one is higher, but you don't get both full amounts at once, and you only collect that spousal additional money if your spouse is actually collecting. So what happens though if you happen to get divorced? Is it possible to collect benefits as a divorced spouse based on your ex's work record? Well, here a few additional conditions must be met. First and foremost, the marriage must have lasted at least 10 years prior to the divorce, 10-year duration of marriage requirement. Second, for you to collect as a divorced spouse, you cannot be married. You cannot be married. Now, your ex, he or she can have remarried without impacting your ability to collect, but you cannot be married. Thirdly, you have to be at least age 62 or older. Earliest age a divorced spouse can collect, no different than regular spousal benefits. But here's an important distinction. As I mentioned, if the marriage were intact, you couldn't collect as a spouse unless and until your spouse was actually collecting his or her own retirement benefit. But what the law says in case of divorce spousal payments, as long as both of you and your ex are over the age of 62 and the divorce was finalized at least 2 years ago, you can collect potential spousal portion even if your ex has not yet started to collect. With all those conditions being met, what are you entitled to receive? Well, simple. It's if the marriage were still intact. You'd be eligible to receive 50% of your ex's full retirement age amount or your own. Again, one amount to the other, whichever one is higher, not both at once. And if your own full retirement age amount exceeds 50% of your ex's, then you collect solely based on your own work record. Incidentally, divorce spousal payments treated absolutely, totally, completely independently from anyone else who might be collecting on the record. So your ex could have a whole series of 10-year marriages, each one of the exes potentially eligible to collect without impacting anyone else who might be collecting on the record. So spousal benefits, divorce spousal benefits. Well, what about survivor benefits? Now the news is a little bit better. With spousal benefits and divorce spousal benefits, the payment's based on 50% of the other person's full retirement age amount. But in survivor benefits, payments to widows and widowers, the payment is based on 100% of what the deceased was collecting or would have been collecting had they started drawing benefits the month they passed away. Oh, yeah, still, or your own. You always get just one or the other at a time. You don't get both at once. So, for example, you're getting $800, your spouse is getting $1,000, your spouse passes away. Assuming you're at your full retirement age or older, you'll begin to receive an additional $200 a month, moving you from the $800 you've been collecting on your own up to the $1,000 that your now deceased spouse was collecting. That's the good news. The bad news, though, is if you think about it, while there were two of you, you were getting 2 Social Security benefits each month at your house. In our example, $1,800 a month. Well, your spouse passes away. Sure, your individual payment goes up, but it's as if your old benefit goes away because it's always one or the other, whichever one is higher, but you don't get both full payments at once. Survivor benefits can be paid a little bit earlier. Widows and widowers can collect as early as age 60. But again, the same concept holds. You start sooner, you get a lower amount. You start at the earliest point. Right at age 60, you get 71.5% of the amount you'd receive if you waited all the way until your full retirement age to collect. But this third bullet is a key one. Yes, I emphasize you don't collect both full benefits at once, but it is possible with survivor benefits to sequence the collection. And what do I mean by that? Well, simple. For example, you're a widow at age 60. You could opt to collect at a reduced rate, but at your full retirement age, switch over and begin to collect a full unreduced retirement benefit. The fact you've been collecting a reduced survivor benefit doesn't preclude you from collecting a full unreduced retirement benefit. And the reverse could be true. You could start to collect a reduced retirement benefit at 62, for example, and then at your full retirement age, switch and collect a full unreduced survivor benefit. But the key thing is you're only collecting on one amount or the other at a time. You don't get both full benefits at once. But here's a key point that enters in whether you're talking about retirement benefits on your own, spousal, divorced spousal, or survivor benefits. It's important to remember that if you're under your full retirement age, looking to collect, but intending to work at the same time, there's an earnings limitation that comes into play. This year, you're allowed to make up to $19,560 without any loss of benefits. You make over that, Social Security is required to start holding back $1 in benefits for each $2 that you're over the threshold. But the good news is once you reach your full retirement age, there's no longer any earnings limitation. But this earnings limitation, again, applies to survivor benefits. So you could be a widow at age 60, making $1 million a year. You're not going to be able to collect, not because you're not old enough, not because you're not a widow, but because that earnings limitation applies to anyone under his or her full retirement age. So we've talked about survivor benefits, we talked about spousal benefits, we've talked about divorced spousal benefits. I want to spend a couple of minutes now till the end, bringing you up to date on some issues surrounding Medicare that I think are important for you to understand. Medicare is the federal health insurance program for people who are 65 years of age or older, who have been collecting Social Security disability benefits for at least 2 years, diagnosed with ALS, permanent kidney failure, and there's a new category of people eligible for Medicare, folks who've been exposed to environmental hazards, particularly out west. Medicare has been around since 1965, and Medicare eligibility at that point set as age 65, which at the time coincided nicely with Social Security full retirement age of 65. We've already talked about full retirement age for Social Security is now increased past that point. So just a reminder, Medicare eligibility hasn't changed. So at age 65, you still need to investigate whether you need to enroll in Medicare or not, regardless of what you're thinking about doing for Social Security benefits. With Medicare, there are a number of different parts. Part A, it's hospital insurance. It helps pay for an inpatient stay. If you're admitted to the hospital and you have Medicare Part A, you pay a deductible. 2022, it's $1,556. You pay that $1,556. Medicare Part A covers the remainder of your inpatient hospital stay. Medicare Part A comes with no monthly premium attached to it. You get Part A of Medicare for free as long as you've worked and paid into the Social Security and Medicare system for at least 10 years. Part B of Medicare, it's medical insurance, helps pay for non-inpatient stuff. And with Part B set up, so you have an annual deductible you have to meet. You have to pay the first $233 in approved charges this year, but after that, Medicare pays 80% of those doctor's bills and other non-inpatient medical expenses. Now, the key thing is with Medicare Part B, if you want it, is a monthly premium you have to pay. And in 2022, the base premium is $170.10 per month. People with higher incomes do pay more than that base premium, but $170.10 per month is the base Part B premium this year. If you're collecting Social Security benefits at the time, that premium amount simply withheld from your Social Security payments. If you're not yet collecting Social Security, you get billed on a quarterly basis for your Part B premium. The last part of Medicare to cover today is Part D, Medicare prescription drug coverage, which was not part of the original Medicare package passed back in 1965. It was added in 2003 with passage of the Medicare Modernization Act. But with Part D of Medicare, if you want prescription drug coverage, you can get it under the Medicare umbrella. But the key difference with Part D is it's offered through private insurance companies. Part A and Part B are standard. You sign up with Social Security for them. But if you want a Part D Medicare prescription drug plan, you sign up with the insurance company. And all plans have the same basic coverage issues, but premiums may differ, deductibles may differ, and the particular prescriptions that are covered under a particular plan may differ as well. So you may have to do a little more investigating to figure out which Medicare Part D plan makes the most sense for you. What I want to emphasize today is the importance of the point I had made a little bit earlier, which is investigating whether you need to enroll in Medicare at the time you turn 65. Because under the rules today, you never have to enroll in Medicare. You never have to take Medicare. But the issue is if you don't sign up when you're first eligible and then try and get on at a later date, with one exception, you're going to face higher premiums and delays in your coverage. So let's talk through what they talk about and call Medicare enrollment periods. So you're given this initial enrollment period, which is a 7-month window surrounding your 65th birthday, the 3 months before, the month you turn 65, the 3 months after. As long as you enroll in Medicare at that point, you're going to be faced only with the base premium amount and no delays in coverage. But the issue comes if you don't enroll during that initial enrollment period and try and get on at a later date. And again, with one exception, which we'll touch on in a second. But you are then forced into what is called a general enrollment period, when you can only sign up during January, February, or March, and your coverage doesn't become effective till the following July, and you face a permanent premium surcharge for each year you had delayed enrolling in Medicare. Now, the one exception is this: if at the time you turn 65, you're covered under your employer group health plan or your spouse's employer group health plan. And here's the key point, because either you or your spouse is still an active employee, then you're given what is called a special enrollment opportunity, meaning you can sign up for Medicare when that employer coverage ends and not be faced with any delays in coverage and not be hit with any type of premium surcharge for late enrollment. Now, the key thing is you have to have this employer coverage because either you or your spouse is an active employee. You can't have retiree coverage and be entitled to this special enrollment period, nor does COBRA coverage count. Because if you have COBRA coverage, if you think about it, yeah, you have your employer health coverage, but you're not an employee anymore. So that's why it's really important around the time you turn 65, talk to the folks at Social Security, investigate whether or not you do need to enroll in Medicare or not. Because again, while you never have to, the issue comes if you don't sign up on a timely basis, potentially face delays in coverage and higher premiums. The folks at Medicare have their own website and their own 800 number. Get more information by calling 1-800-MEDICARE or by going to their website, www.medicare.gov. For more information about Social Security benefits, well, Social Security's got their own website, www.socialsecurity.gov. You can also call their 800 number, 1-800-772-1213. So we've covered a lot of stuff really quickly. I hope it's been helpful, but we're going to open it up to questions and answers, and I'll be happy to take any you may have. Dave, we'll turn it back to you.
Sure. Thank you. Very informative as usual. So the question was, if the person's working after their full retirement age, they take Social Security, do those working years or months count towards potentially a higher Social Security benefit?
And the answer is absolutely possibly. So we didn't talk about how your benefit figured, but your benefit is calculated by averaging your 35 highest years of work under the system. Now, Social Security does go back and adjust prior year earnings for inflation, bring them up to what they are in today's dollars, but then they pluck out and average your 35 highest years of work under the system, apply a formula to that, and that's what determines your benefit. The important note is it's not necessarily your first 35, it's not necessarily your last 35, it isn't even necessarily 35 consecutive years. As long as you're working and paying into the Social Security program, at the end of the year, you're going to file your tax return. And if you're collecting benefits, Social Security will automatically do a match. They'll compare that new year of earnings with the 35 years they've been averaging. And if that new year of earnings is higher than the lowest of the 35 years, well, they're going to drop out the low year, plug in the new year, and it will result in a benefit increase for you going forward. And this ability to increase your payment through additional work and earnings, it continues forever. Delayed retirement credits, yeah, they stop when you turn age 70. No additional bump by not collecting past age 70. But no matter how old you are, if you're working, paying into the program, even if you're collecting benefits, if your new year of earnings is higher than the lowest of the 35 years that they've been averaging up until that point, you'll see a benefit increase as a result of those additional earnings, no matter how old you are. And frankly, the other bit of good news about working is it really never hurts. Even a high-priced executive in retirement, take a part-time job at the local golf course, driving the beer cart around, make a couple $1,000. Well, chances are that couple $1,000 is going to be lower than the lowest of your 35 years of earnings. So what happens to your benefit going forward? Nothing. It stays the same. It's always an average of your highest 35, regardless of when they occur. So I said, I think good things can come to those who wait. Good things can come to those who work as well. Because as long as you're working, paying into the system, even if you're collecting, if your earnings are higher than the lowest of your 35 years, you're going to see your benefit increase as a result of those additional earnings. And even if they're lower, you're not going to see a decrease in your payment either.
Adding to the Social Security list of questions, there evidently are some employees who have a spouse who has been a teacher or is still a teacher or in education, municipalities. So the question was, that individual likely is eligible for a pension, and maybe they qualified as well with their 40 quarters for Social Security, and they're going to get a little bit of a stipend in addition, to the pension. So how does that all kind of work in terms of, the retiree that's the teacher,
Sure.
getting their pension and maybe potentially some Social Security? And then how does it kind of coordinate with the spouse,
Sure.
and their Social Security?
Great question. Comes up all the time, particularly here in Massachusetts, where public employees don't pay into Social Security. So there's two provisions of the Social Security program that impact folks who receive a public pension, and this is the key thing, which is based on work not covered under the Social Security program. Massachusetts school teachers don't pay into Social Security. New York school teachers do pay into Social Security. So for a Massachusetts school teacher or any other public employee who gets a public pension based on work, again, not covered under the Social Security program, they're potentially impacted by two provisions of the Social Security program. One is called the Windfall Elimination Provision, abbreviated the WEP, and the other is Government Pension Offset, or GPO. Provisions are different, but they're not mutually exclusive. You can be impacted by one or the other, and perhaps both at once. The windfall provision, that impacts somebody who gets that public pension, but who, in addition to their public service, has worked and paid into the Social Security program for at least 10 years. They've accrued their 40 credits. Well, the good news is you're always going to get something every month from Social Security, even if you get that public pension. That's the good news. The bad news is, because of the windfall provision, the amount you get each month, absent 30 or more years of time under Social Security, is not going to be as high as it would be if you didn't have that public pension, because Social Security is required to use a different and admittedly less generous formula to calculate that person's benefit. But you'll always get something. You're never reduced to zero. Government pension offset, that is what impacts somebody who gets that public pension, but now is attempting to collect benefits as a spouse, divorced spouse, or widower. And frankly, here the news is not as good. Now, you'll always get something with that public pension with your own 40 credits, but before Social Security will pay you any additional money as a spouse, divorced spouse, or survivor, they're going to take a look at the amount of your public pension, figure out what 2/3 of your monthly pension is, and then reduce any additional spousal, divorced spousal, or perhaps survivor benefit by that 2/3 of your pension. So if 2/3 of your pension is more the additional money you could collect based on the work record of your spouse, ex-spouse, or deceased spouse, you don't get anything more. You get your own Social Security benefit, you get your full teacher's pension, but with government pension offset, you may not get anything more. Why does government pension offset exist? Well, I talked about with spousal benefits, divorced spousal benefits, or survivor benefits, you collect on one amount or the other at a time. You don't collect both full benefits at once. Government pension offset passed 1977 because Congress recognized that people with those public sector jobs were being treated better than people who had worked under Social Security. Because prior to GPO, if you had a teacher's pension, you could get a full teacher's pension and a full spousal benefit. Whereas if you had worked under the Social Security program, you'd collect on one or the other, not both at once. So government pension offset designed to bring those public sector employees and pensioners under that same concept with Social Security, that you collect on one amount, one account to the other, but you don't get both full benefits at once.
This particular employee has Blue Cross through her husband's mass teacher's retirement. She asks, can she only sign up for Part A Medicare, no cost, to avoid later penalties?
No reason not to sign up for Part A at age 65 because it's free. So general advice to anybody, sign up for Part A at 65, it's free, doesn't cost you anything. You get a nice red, white, and blue healthcare card. And if you're admitted to the hospital, even if you got some other type of coverage, just hold out your Medicare card and whatever other insurance coverage you have, let them figure it out. So Part A, no reason not to enroll in Medicare Part A at 65 because it's free. The bigger issue, though, is with Part B, because that's where the late enrollment may lead to a higher premium and delays in coverage. And as I said, you get a get out of jail free card if at the time you turn 65, you've got employer group health coverage, either through your own employment or your spouse's employment. And the key thing is either you or your spouse has to be a current or active employee. So if I read the questionnaire right, or the question right, she's got coverage through her retired husband's health insurance. Now, again, you never have to sign up for Medicare, but if you don't sign up when 65 and then try and sign up at a later date, having this retiree-based coverage doesn't entitle you to that special enrollment period. The only way you have that get out of jail free card is if the coverage you've had at 65 is because of your or your spouse's active employment. Retiree health coverage, it may be great, but it's not what will entitle you to sign up late for Medicare Part B and Part D without incurring a penalty.
The question of Medigap coverage, comes up. Should I, buy a supplement to take care of the doctor visits and, maybe my deductible, under the Part A? What is, the opinion on that, to buy a Medigap or a supplemental? The resources, I can tell everyone the resource that I would highly recommend you look at is AARP for a supplemental kind of, Medigap policy. But more to the question, Kurt, when is it recommended to buy a supplement, or should you always do that?
Yeah, and the answer is beats me. It's an individual decision, but I'll expand on that answer. But Social Security was never intended to be your only source of income in retirement, designed to provide a foundation that you need to supplement. Medicare is the same way. Medicare designed to provide a base of health insurance protection. By design, Medicare doesn't cover everything. Again, Part B, you have a deductible, and then Medicare only pays 80% of the basic charge. There's a lot of other things that Medicare doesn't cover, eyeglasses, hearing aids, things like that by design. So as a result, people who are approaching Medicare need to look and see, well, am I comfortable with just the base level of protection that Medicare provides, or would I be more comfortable purchasing some type of, and the term of art is a Medigap or Medicare supplement private insurance policy, because that Medigap term comes from the fact that private insurance fits in the gaps in the basic Medicare coverage. And I always say it's an individual choice, an individual decision. And then if you're comfortable, have gone through life with robust health insurance, yeah, then probably by all means, you're going to be more comfortable purchasing some type of Medigap policy to provide that additional insurance coverage you may be used to having. But again, it's an individual choice, an individual decision. The important point is, by design, Medicare doesn't cover everything. There are gaps in the coverage, and it may well be in your interest to purchase some type of Medicare supplement plan to help cover the things that Medicare by design doesn't cost. There's a whole wealth of information out there about that whole back end of the process, as I characterize it. But again, we're talking about private insurance designed to fit on top of that base Medicare coverage. So just as I never tell people when they should take their Social Security benefits, I think it's an individual's choice, an individual's decision. But if you're used to having robust health insurance, then yeah, by all means, you probably do want to purchase some type of Medicare supplement plan, because they keep emphasizing, by design, Medicare doesn't cover everything. There are gaps that need to be filled.
Very helpful. Again, I'll end it at that. A lot of good engagement